And welcome to the Dr. Bob Show. You know, whether you and I like it or not, at some time we're probably going to have some surgery. It may be abdominal surgery, stomach surgery, anything inside of the abdomen. Do you want abdominal surgery to be done the old-fashioned way where there's a long scar? No. How about the newer ways where we've got laparoscopic surgery where they make 3 little small holes and the doctor is able to look inside and do the surgery with instruments and they do a great, or would you rather have robotic surgery? What is robotic surgery? More and more we're seeing new and better techniques, and we're going to be spending this show talking about robotic abdominal or gastrointestinal surgery. My guest is Dr. Michael Antiporda. Dr. Antiporda is a board-certified surgeon who has fellowship training, that's advanced training, in minimally invasive gastrointestinal surgery. That means he's a super pro at being able to do minimally invasive laparoscopic type surgery in the abdomen. And then he's had extensive training in Da Vinci robotic surgery, where he uses a robot to be able to do the same surgery. There are advantages to you, the patient. There are advantages to the doctor in the robotic surgery. And I'm as excited as you are to listen to Dr. Antiporda as he tells us what robotic gastrointestinal surgery is like. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about atrial fibrillation. Do we really need to take an anticoagulant? They can be dangerous, and how long do we need to take them? And also a brand new word that's taking over medicine. That's called mindfulness. What is mindfulness? Well, we're going to learn how the brain may be our big healer in the future. A lot of information for you. You're going to want to stay tuned. We're talking with Dr. Michael Antiporda, board-certified general surgeon specializing in minimally invasive gastrointestinal surgery, where we minimize the amount of scarring with special training in Da Vinci. That's a special type of robot, robotic general surgery, which is by definition minimally invasive. Michael, welcome to the Dr. Bob Show.
Thanks for the privilege of having me on here.
Well, it's my pleasure. Somebody that's had the training like you've had, it's just an honor and a pleasure to have you at the show. How common is robotic surgery as far as the GI tract goes?
It's becoming much more common, particularly in the past decade with general surgery. It's been used by urologists and gynecologists for prostatectomy and other surgeries previously, but more recently it's becoming adopted and used much more for general surgery procedures.
Do you like doing robotic surgery?
Yeah, it's enjoyable. It's like a new frontier.
When a patient is learning about robotic surgery, what do you tell them the advantages of robotic stomach surgery?
So a lot of the advantages spring off from laparoscopic surgery, and a lot of the features of that or advantages are smaller incisions, quicker recovery, less pain because of smaller incisions, less of a physiologic insult to the patient. And where robotic surgery takes off is that it sort of accentuates some of those advantages and brings more technology to the forefront. So the visualization is 10 times increased magnification in 3D. The instrumentation is similar to human wrist, so you have 7 degrees of freedom. So there's a lot of
how much freedom? I mean,
7 degrees of freedom.
7 degrees of freedom,
like a human hand. So I think it really helps enable some more complex operations, and in some more routine operations, it can perhaps keep things minimally invasive, whereas in another situation, if you were laparoscopic, you might have had to convert to an open procedure and make a big incision.
So when you're doing this, when you're doing the robotic surgery in the abdomen, is it the visualization that's the biggest, or it's the visualization where you know where you are in that person's abdomen to the millimeter?
I think it's a kind of a combination of those. With the robot, you're pretty much your own assistant. So you're driving your own camera, it's super steady, and you're pointing it exactly where you want it to be. And you're not relying on necessarily who you happen to be working with that day. I mean, you could have a great assistant who's with you for laparoscopic surgery, but with a robot, you're always your own best friend. And I think that's something huge that really helps surgeons when they're doing a complicated procedure.
Okay, let's go back to the patient. So the patient, we're telling the patient what robotic surgery is about, and you're explaining to them, well, is it going to hurt me, doc? And what do you say? Do you use anesthesia with it?
Right, so I think along with advances in robotic surgery, there have been a lot of enhancements to patient recovery. And for example, we adhere to a lot of programs that are called enhanced recovery after surgery programs, and these include things like pain medication that's preemptive before surgery and throughout the operation to really minimize.
So you manage pain intelligently to make it where the patient doesn't really experience much problem. Is that right?
Yeah, kind of like in an anticipatory fashion.
Okay.
So that goes along with the robotic surgery.
Less pain. Why is the recovery time faster?
The recovery time is faster, I think, mostly because you're doing minimally invasive incisions like laparoscopic surgery. And I think, again, because some of the operations that would otherwise have to be done open, for example, like maybe a complicated pancreas surgery or a complicated esophagus surgery like I do, you're staying minimally invasive, and that all helps the patient get out of the hospital faster eventually.
When you're managing the robot, how many holes do you have to punch into the abdomen?
It varies. It's as few as 3 if I'm doing hernia surgery for groin hernias or belly button hernias, up to maybe 5 for esophagus surgery. So it varies.
How big is the hole that the robot punches with you guiding it?
The biggest one is just over a centimeter, but generally they're about 8 millimeters in size.
So it takes 2.5 centimeters to make an inch, so it's less than 1, so it's a real small incision.
Yeah.
And once you get in, when you punch those holes, do you have to throw air into the abdomen like laparoscopic?
Yeah, we do. We use carbon dioxide, and the reason we use that is because it doesn't react with the energy we use to do the surgery, and also it's absorbed quickly, so that patients aren't walking around like a blimp after the operation.
Afterwards. And so when the patient, after the surgery and recovery, there's enhancement of recovery time, you said. How long does it take them once they get off the surgery table with the robot before they wake up and go back to the room?
Yeah, I mean, usually people are woken up within and fairly conscious and able to interact with their doctor or the nurses probably within 30 minutes to an hour of the surgery.
And how difficult is it for you, a human, to learn how to guide a robot?
Well, that's kind of the fun thing about the robot, is that as opposed to laparoscopic surgery, which is not intuitive, I'm not trying to shout out the company name, but it's not so intuitive to use laparoscopic instruments. With a robot, it's literally mimicking and mirroring what you're doing with your fingers. So it's much easier for a surgeon who's experienced with open surgery to learn how to do robotic surgery.
So this robot, the robotic surgery, is called Da Vinci, and it's made by a company, Intuitive Surgical Inc. Is there advantage? It seems like the only time I hear of robotic surgery, it's with the Da Vinci. Is that correct? Are they the dominant player in this field?
They are the juggernaut in the field. There's another FDA-approved robotic system that's not as commonly used throughout the United States, and there are more companies bringing their technologies onto the market. We may be years out from seeing them, but I mean, that's good for America's having competition, and they'll just make everything else better.
That makes the next robot be even better. So when you're inside the abdomen, name me some structures that you can do surgery on inside the abdomen. Let's just go slowly one by one.
We can name everything in there. So
Gallbladder?
gallbladder, stomach, esophagus, my favorite.
So you can operate on the stomach. Reflux at the esophagus, and you really like the esophagus. How about in the colon? Can you do things with the colon? So the mesentery, most people, that's sort of a lining. Do you ever have to do anything with the mesentery except push it out of the way?
When you're doing a cancer operation, be sure to take a proper amount to get enough lymph nodes.
So you can do cancer surgery. Can you remove cancers with the robot?
Yes, you can.
So you can really do everything. So you have to really understand the anatomy, or the anatomy is programmed into the robot.
The robot has no ability to work on its own yet. Maybe artificial intelligence will help that someday. But it's entirely controlled by the surgeon, so the surgeon has to know everything.
Yeah, and so you really, do you operate with, the visualization you say is fantastic. Do you have to do a CT scan to get a program of what you're operating on?
Not for this kind of surgery, no.
Okay. Your favorite surgery doing a robot would be what?
Probably fixing paraesophageal hernias.
Paraesophageal. So we're going to be coming back learning about robotic paraesophageal hernia. And we'll learn about what it is, but it's part of GERD, it's part of fixing that. And then we'll go down exactly how we do other surgeries. You'll want to stay tuned. We're talking with Dr. Michael Antiporda, board certified general surgeon with extra special training in robotic surgery. We've learned that it has many advantages to the patient. They have less recovery time, less pain, less discomfort, less bleeding. I mean, everything that you want is beneficial to the patient. From the surgeon's standpoint, you have visualization that makes things look 10 times their normal size. You know exactly where you are. The robot knows exactly where you are. And so your ability to manipulate that is really down finite. To me, it was just fascinating. It's almost like a video game, as you mentioned. If you're used to playing video games, does it help a robotic surgeon?
I think it is germane to it. I think there's a lot of hand-eye coordination that goes along with video games, and on the robot you're handling multiple contraptions at the same time. And it's also kind of like if you play the piano and you have to be able to activate the foot pedals.
Yeah.
That's important for using the robot also. It's like I'm using all my limbs and not just my brain to do the operation.
So what does the Da Vinci robot look like? Is he a walking robot, or is he just got an arm, or is he a machine? What is he?
Well, so the patient cart, the part that comes up to the OR table and is docked to the patient, it looks kind of like a four-armed squid, I suppose I'd say. And the four instruments are, one of them has a camera, and then you have three other arms that can be used to do the operation.
And I bet that's a sophisticated camera that gives you the perfect visualization. To me, that's really one of the great things about that. You just can't help but knowing exactly where you are, and the computer has in his brain what's going to be going on with your help. Let's talk about the paraesophageal hernia. Now, is that a special kind of reflux hiatal hernia? What is that?
Sure. So I guess I'd start with hiatal hernias, which up to 25% of the population can have at some point in their lives. It's when the hole in your diaphragm or your esophagus goes through. If it's too big, then part of the stomach can go up into the chest, and if that happens, then that can cause symptoms like reflux or heartburn, sometimes chest pain, and it can be a difficult thing to manage.
It can ruin a person's life, and you have the ability to help it. So first thing we do is put the patient on the table, bring the robot in, and then what do you do? Yeah,
so after the patient's asleep and everything's set and the robot's brought into the room. We make 5 small incisions on the patient's upper abdomen. Then we inflate
the upper part of the stomach, you're going to have 5 little holes that are very, very small. And keep going.
Okay. Next, we inflate the abdomen with carbon dioxide. And then we put our instruments in, including the camera. And then after we do that, then we proceed with operation, which entails mobilizing the stomach and bringing it down into the abdomen from the hole.
From the hernia. So if the stomach is up here, you bring it down where it's supposed to be, all with the robot.
Right.
How do you fix it there?
Right. So, and then this is kind of where the robot comes in handy, is because with the precision from the instruments, there's a lot of valuable real estate, because where the esophagus is going, the heart's right in front of it, the lungs are on either side, and your aorta is behind it. So it can be a high-risk operation, but if you know what you're doing and you have the tools, and if you have a robot, which can help, then you can do this safely. But it involves freeing up the esophagus and stomach, moving the stomach.
Free up the esophagus and the stomach, and then what?
And then when you have the hernia visualized, then you put some permanent sutures in it to get it to a normal size.
What are the sutures like? Just like regular sutures?
These are permanent braided sutures. I usually use something called Ethibond.
Called?
Ethibond.
Ethibond. Yeah. I'm not a surgeon. I don't use sutures of that. So it's a small, strong suture that you can put to keep things in place. So what is your purpose on that? You said paraesophageal. That means beside the esophagus.
Correct.
You've pulled the stomach down. You've got it ready. You close up the diaphragm around the hole.
So you've got your stitches. If the hernia is especially large and we want to reduce the chance of it coming back, some surgeons may use a certain kind of absorbable mesh. Not a permanent one, because there have been studies showing that the permanent mesh might maybe erode into the esophagus, which obviously nobody wants. And then part of the operation is doing what's called a fundoplication, which is wrapping.
Fundoplication. Now that's a word I've heard about, and that's where the surgeon can go in and fix the hiatal hernia. But here you're doing a similar procedure with the robot.
Correct.
So what is it? What do you do?
So it wraps the upper part of the stomach around the lower part of the esophagus, and it creates a new one-way valve to prevent reflux of stomach contents into the esophagus.
When you have done that, when you have guided the stomach to where it's supposed to be and the esophagus, and you've tightened up the hole in the diaphragm, have you fixed it?
You have, yeah. And then, so the operation's done, you wake up the patient, and they're home in the next day or two.
In the next day or two, they're home. So how long does it take that person with that? That means somebody has significant hiatal hernia. This is a significant procedure with lots of things. So how long does it take the person where they can swallow good, burp good, drink good, have the functions of swallowing?
Sure. Well, right away they can swallow liquids. Whenever we operate on the stomach or esophagus, it can make it swell a little bit. So we do a pretty slow graded progression of food, but eventually a couple weeks out, everyone's able to swallow the food that they enjoyed again. So they don't have the trouble with reflux, so they can eat all the Italian or Mexican food they want, and drink all the red wine they want.
Wouldn't that be great for somebody that had to stay away from spicy foods, and you say, all right, go ahead, eat it. I'd be afraid to death to eat that. Now, you've operated on the stomach, a very important procedure, very important organs around the area. Is there pain and discomfort for how long after the surgery?
Maybe typically just for a few days after surgery, and it's mostly related to just the incisions. But the actual stomach and esophagus, patients typically don't experience discomfort with those.
Second most favorite, we'll get away from the esophagus for a minute, get away from the reflux area. Gallbladder easy?
Yeah.
Okay.
When it's not super inflamed.
That's a nice thing. Every patient's different and every operation is different. Does the robot make taking out the gallbladder, which is right under the liver, does it make it easier to guide the removing of it?
It makes it incredibly easy, actually, like almost too easy. It's almost not fair.
And isn't that wonderful?
Mm-hmm.
You know,
I mean, if it's easy for the surgeon, then it's safer for the patient.
Absolutely. Another abdominal procedure. How do you remove a tumor? Let's say you've got a cancer in the intestines and you're removing that. What's the cancer feel like to the robot?
Sure. Well, I actually did one of these just today before the show.
Just today?
With the robot, of course. So let's say, for example, it's in part of the bowel. Let's say it's in the colon. Well, you do the operation similar to how you would open or laparoscopic with regard to how much you're taking out. But you have to use visual cues, and you have to really know your anatomy to know just how to do it using the robot. And then once it's out of the body, then you can inspect the specimen and make sure that you got everything that you came to do.
Well, I want to ask you on the patient today. In general, how big a tumor can you remove? As big as it's there?
You can. The trouble is getting it out. So I've seen cases where we did a minimally invasive operation and then did have to make a bigger incision just to pull out something big.
Yeah, and sometimes when you read the medical surgical journals, you're amazed at how big a tumor can be. What if you have a little bitty tumor that they say is present somewhere near the spleen or something? Is that more difficult?
It can be, but again, that's one of the advantages of the robot is the visualization, so that can enhance the surgeon's ability to find what they're looking for. And there's some other adjunct or other things that can help, like using ultrasound inside the abdomen when you're doing the surgery, and sometimes using some other technologies like lighting up tumors with like fluorescent dye.
Sure. It sounds to me like with the advances in robotic surgery, if I needed stomach surgery, that I would look for Michael Antiporda because he is a robotic surgeon who specializes in gastrointestinal minimally invasive. You're a great teacher. And I really thank you for coming to the Dr. Bob Show. I had no idea what robotic gastrointestinal surgery is like. And yet you've explained it to where I know it's less discomfort for me and more exactness of what you're doing to remove the problem that I've got. Thank you for coming to the Dr. Bob Show.
Thank you.
Wow, I just think that's fabulous. It makes it where I feel like, wow, I don't have any fears of robotic surgery. It sounds like it's really the thing of maybe the wave of the future. We'll just have to see. Medicine is advancing, surgery is advancing. Now you're going to want to stay tuned. We're going to be talking about atrial fibrillation, the left atrium, of why do we have to take anticoagulants and what's the left atrium got to do with that, and the word mindfulness. Can the mind be the new healer of the body in the future? It may well be. It's really exciting. You're going to want to stay tuned. I want to thank Dr. Michael Antiporda. Wonderful discussion on robotic abdominal surgery. Wasn't that fabulous? Now, questions from you, the viewer, that I think will be important to your health. We're only going to have one question. It's going to be on mindfulness, and we'll talk about atrial fibrillation anticoagulants later on. What is mindfulness? It doesn't sound like much, but here's an article from Mayo Clinic. And Mayo Clinic states that mindfulness may be the wave of the future for many illnesses. It's a way of thinking yourself healthy. So let's look at some mindfulness exercises. You can do them sitting down, you can do them walking, you can do them when you're in yoga position. But what you do is you listen and feel the air as you breathe in through your nose, and you concentrate just on that, on nothing else, just on the breathing. And then as you exhale, you think about getting rid of pain in your fingers, or chest pain, or arthritis, or nervousness, or emotions, anything that's bothering you. Just feel that air go in your nose and let your body not think of anything else, and then think about the problem that you're having fading away. It's almost like hypnotism. It's almost like yoga. It's a way that the mind will begin to control the body. We know that the mind can change the blood pressure in our fingers, the circulation in our fingers. We know the mind can teach us to relax. We know if we take a deep breath and strain down, it will reduce our pulse. So we can begin to use the mind to control different illnesses, and it will be more and more important to you and me, according to Mayo Clinic. So Google mindfulness, Google mindfulness exercises, see if taking that breath can help you get rid of anxiety, stress, pain, sleep problems, all of those. And now, what are those 4 things that we like in the Dr. Bob Show? Well, let's go over those. Number 1 is exercise. Exercise, extremely important. Everything you do helps us lose weight, helps us to bring our blood pressure down, helps us to feel better, causes a runner's high. Eating properly, remember, more fruits, more fibers, less fried, less greasy foods. Don't eat those. Just eat good foods, you'll stay healthier that way. And 7.5 hours of sleep. If you're not sleeping well, think of why. Talk it over with your doctor. If you snore, ask somebody if you snore and work that out with your doctor. It could be the most important thing that you do along with the others. And most of all, what is it we like? It's that laughter in your life. Laugh a lot, and giggle a lot, and you'll stay healthier.